Good morning, welcome. Thank you for joining us virtually for a press briefing. My name is Kelly Chandler. I'm the Public Health Division Manager for Itasca County. Itasca County is hosting press briefings to highlight themes emerging in our community related to COVID-19 or frequently asked questions posed by our community members. Today we will be discussing long-term care. Early on in the pandemic, our skilled nursing and assisted livings were closed to visitors and residents were not able to leave to enter into the community. This was needed to control the spread to our most vulnerable and those who could experience more devastating effects if catching COVID-19. We have learned of the unintended consequences of these restrictions with more isolation, loneliness, and with the inability to see family and friends for our residents of our facilities. More recently, Governor Walz has lifted some restrictions for visitation of our residents in the facilities and has also provided some guidance on allowing family members to be caregivers. Our panelists today will speak more to the restrictions as well as the protocols in place for long-term care facilities. We are joined today by Dr. Stacy Hall, internal medicine physician, Grand Itasca Clinic and Hospital, and medical director at Grand Village. Kyle Headland, executive director, Grand Village. Melissa Walters, director of operations, Progressive Care, which includes River Grand and Majestic Pines of Grand Rapids. Blake Danke, campus administrator, the Emeralds at Grand Rapids. Danny Donner, director of senior services, Bigfork Valley Communities. And Monique Fox, administrator, Essentia Health, Deer River Hospital and Clinics, and Essentia Health Homestead. We will also have Jean McDonald, president and CEO of Grand Itasca Clinic and Hospital, on for question and answer at the end of our panelists speaking. We'll start with a situation update. We have 113 Itasca County residents who have tested positive to COVID-19, and we remain at 12 deaths. The case age ranges are from 6 to 94. Our cases have increased by 45 since July 7th. Cases are mostly community spread from both known and unknown sources. The increase in cases are from multiple age groups, from young adults to elderly. Itasca County Public Health is conducting case and contact investigations along with the Minnesota Department of Health. We do ask that if you have a positive COVID-19 case or were in close contact with someone who was positive and a public health staff contacts you, that you answer the phone. Statewide, overwhelmingly, persons who have received information from a case or a contact investigation have had a positive experience and are very appreciative of the call. As you may have heard, masks have been required in indoor spaces as of July 25th, this coming Saturday, in the state of Minnesota. We have posted some frequently asked questions on our Facebook, social media for Itasca County Public Health, and we will be providing more information on where to access masks in our next written press release. At this time, I would like to introduce Dr. Stacy Hall, again, internal medicine physician, Grand Itasca Clinic and Hospital, and medical director of Grand Village.
Thank you. I appreciate being part of this morning. Like Kelly said, I am Dr. Stacy Hall. I work in internal medicine here at Grand Itasca Clinic. I'm also the medical director out at Grand Village. I am wearing my mask because I have some people in the room with me, but please let me know if it's hard to hear what I'm saying at all. So I was kind of asked to talk about the vulnerability of the elderly population. And as a whole, this is a topic that you can spend months learning about. There's classes and specialties that cover the whole thing. But in the brief time that we have, I just was going to touch base on a few points. As an internal medicine provider, I primarily care for people over the age of 60. And a couple of things that we see as people age are just an overall decrease in the immune system, which makes them more prone to all illnesses, and in addition at this time, coronavirus. We also see a lot of medical problems that come up in this population, and of course, in return, then medications that these patients get put on that can contribute to more illness and disease and more severe courses of care overall. As as we age, of course, more people end up in nursing homes, and as a country, we serve about 3 million people in our nursing homes on any given year. When you start looking at the way coronavirus has been affecting the nursing homes and the elderly population, about 40% overall of deaths in the United States have occurred in these facilities, despite only about 0.6% of the population being residents of these facilities. And so we definitely see that as a real significant impact from COVID-19. The additional things that kind of lead to that is, in general, as these patients age and they end up in nursing facilities, we see a lot more functional decline. So people are unable to care for themselves in the same manner as they would have when they were younger. And this leads to decreased hygiene, increased reliance on people around them, which of course means an inability to be separate for some of the most common daily cares that are needed. And so as a whole, this population just tends to be more at risk of transmission and more severe disease across the board. More specifically in Minnesota, we've seen, just looking at the data from this week, about just over 1,500 deaths, and of these, about 77% have been in the long-term care facility range. So I'll kind of leave it with that, because I know we're kind of limited on time, but I'm happy to answer any specific questions at the end here.
Thank you, Dr. Hall. I will now introduce Kyle Headland, Executive Director, Grand Village.
Hello, everyone. Thanks for having us today. A little quick background on Grand Village. Grand Village, we're a 119-bed skilled nursing facility in Grand Rapids. We are owned by Itasca County. We actually began serving the community in 1896. So we've been serving Grand Rapids and the surrounding area for over 124 years. We're owned by Itasca County, like I said. We're managed by Ecumen, one of the larger senior care providers in Minnesota. And our mission here at Grand Village is we empower individuals to live a fuller life. And we've really tried to focus on that during this very difficult time. Like Kelly said, all of our facilities very early on in the pandemic closed down for visitors, which was very difficult, but we've tried to find ways to bring joy still on a daily basis, whether that's through, very early on, we set up virtual visits and really expanded our activities department so that we could still provide one-on-one socialization with our activities team and with our direct care team with all of our residents and our patients. And that we actually saw a large adoption of that with our families. And I think on some level, we were seeing more visits from families because of the virtual visits who live out of town with their loved ones due to that, which is really great to see. We have a family room area that's a closed off window that we set up a temporary phone line with a speakerphone so families could sit outside and visit with their loved ones with large windows, and then the residents can sit in a climate controlled area still. And so that was really successful early on as well. And now that things have restrictions are loosening up a little bit, we're able to do window visits, keeping the visitors 6 feet apart and with their masks on. And then we're also doing the outdoor visits now as well. And those have been going really well. And we're getting a lot of positive feedback from our residents and our patients and the families at that socialization that can happen. And so it's difficult from a staffing standpoint because we need somebody to manage the schedule for that with our outdoor visit stations and kind of monitor the visits from a distance to make sure that people aren't coming within 6 feet of each other, that they're keeping their masks on, and then disinfecting the visit area between visits. But those are going really well, and we've really enjoyed seeing the smiles on everybody's faces when they're visiting with each other. Moving in, now that the state has opened up some guidance on essential caregivers, we've been working on that program and putting policies and procedures and protocols in place to ensure if we do have essential caregivers coming into the building that we're still minimizing the risk of transmission, and ensuring that those visitors are educated and sign off that they will follow all of our infection control and personal protective equipment policies and procedures. So we're looking forward to that as well, to provide that additional socialization for our residents and their families. Very early on with Itasca County and all of the other providers on the call today, it was really heartening to see the collaboration within our county and all of the different providers. I think we're all communicating more now than we had ever in the past, and it's been a really fun collaboration to see the ideas people have and the willingness to help each other, whether that's through sharing supplies early on, seeing where everybody was at with supply levels, directing volunteers to make cloth masks. It was really a whole community approach, and I think that's why we've been really successful to this point as a community on managing the pandemic. I think that's all I have. Unless I have more time, I can keep talking.
We'll jump back to you on the Q&A portion, Kyle.
Right.
Thanks. Melissa Walters, Director of Operations, Progressive Care, which represents River Grand and Majestic Pines. You're muted, Melissa.
There we go. Okay, well, good morning. I think I really don't have to talk now because Kyle pretty much just said everything that I had to say. So I'll run through some additional points. So I work for Progressive Care, as Kelly said, and we are the management company that operates Majestic Pines and River Grand in Grand Rapids. And just to give you a little bit of background on our buildings, Majestic Pines is an 89-unit building and River Grand a 61-unit building. And we offer a combination of independent living, assisted living, and memory care services within those buildings. We also offer an outpatient therapy clinic within our Majestic Pines building that serves both our tenants within our buildings as well as community members. And I just want to paint a little bit of a picture of what life was like before the pandemic hit in our buildings. While we mirror a lot of what happens in the nursing home environment and we follow a lot of the same regulations, there are some differences too. But I think Kyle could probably agree that some of these changes are some things he's seen too. Before the pandemic, you would walk into one of our buildings and really just see a vibrant, lively community, people eating together and socializing and doing activities together, whether it be exercises or other activities. And that world looks very different now. It looks very different. So when this hit in March, and we had to make immediate changes to our daily operations. We had to, obviously restrict visitors, like Kyle said, universal masking. We no longer see everybody's smiling faces walking around the hall because we're all covered up. Enhanced cleaning procedures, social distancing. You just really don't see that sense of community that so organically happened before the pandemic hit. So, with that has come some challenges, obviously. And we've had to navigate these waters with sometimes almost daily changes. It seems like as soon as you get a policy in place, the next day something else is coming out. And that ripple effect is huge, how that flows right down to your staff, your residents, your families. And I just want to take on to what Kyle said about the coordination that has happened in this community has been incredible from the get-go. We have partnered with our local healthcare providers, with Itasca County Public Health, MDH, and really, I've been in healthcare for over 20 years now, and obviously this is an unprecedented time that we're going through right now. But anytime you see sort of an upset in the environment, there seems to be a lot of confusion and conflicting information. And I just feel like our community entities have worked so well together to come up with a unified message and really help guide us through these uncharted waters, which has been really wonderful. So thank you guys for that. I could talk on and on and on about this pandemic. It's I can't even tell you this is my day every day. I feel like this is my job, should be COVID specialist at this point. But I think that the negative pieces of this pandemic get enough attention. So I really just want to kind of draw some attention to some of those positive things that we're seeing. You know, I really want to give a shout out to our staff, our residents, and our families, because they have all been so flexible and understanding during this time. We've asked staff to do things they've never had to do before, to take on workloads they've never seen before, change the way they do their daily operations. And when you implement such large amounts of change so quickly, you expect to see some pushback and some negativity, and we have not seen that at all. Our staff have jumped right on board, embraced everything, and really taken it upon themselves as their responsibility to now bring joy into our buildings every day, because there's really nobody else that gets to do it anymore. So they are the ones. And then our residents and families too. You know, our apartments that our residents live in, these are their homes. And we're asking them to change how they live in their homes every single day. And I don't know about you, but I would probably be a little bit resistant to that if somebody came into my home and said, I'm going to tell you how you're going to live in your home now. But they have been so trusting in us that these restrictions that we've had to put in place and the guidelines that we've had to follow have been for their protection. And really, they've been so understanding, and we just appreciate that so much, both from the residents and the families. They've been, I cannot speak enough to how wonderful they've been. We have done some of the same things to date to try to reduce isolation, you know, the FaceTiming, increased phone calls, one-on-one visits. Our physical therapy department has been instrumental in really working with residents to give them some ideas for ways they can stay active on their own or through one-on-one visits. We are starting to see some modifications in the guidelines, as Kelly and Kyle have both mentioned. We have resumed some form of communal dining within our building, but it looks nowhere near what it used to. It's one tenant per table. You have to be socially distanced, at least 6 feet apart. A lot of sanitization between shifts of dining. And so that's been really great to see that open back up. We have been doing the window visits, which have gone very well. And the outdoor visits have been extremely well received. It's great to, you know, see people get to at least not have a barrier between them and their loved ones when they're visiting. They still have to be socially distanced, but they at least get to see them. So, you know, we're working through some of this essential caregiver information right now too. And really, you know, we're eager to get on board and want to participate in it. And we know that it's something that our residents and families need, but it's a very delicate balancing act of weighing. You know, we've worked so hard to keep people safe during this time, and we've been pretty successful at it. And now it's really a scary thing to kind of start opening those doors back up again. We know we want to, we just want to make sure that we have all of the information, we've weighed everything, we have a really solid plan in place to move this forward. So that is on our radar. It's probably the biggest thing we're working through right now. We have not yet completed testing with the National Guard. We are signed up to do it. So both of our buildings will be going through testing. I believe it will be the first week in August. And so that's another big thing on our radar right now. Other than that, we're just looking forward to the days that we can open up the building fully again safely and get back to what we believe to be normal.
Thanks, Melissa. We'll now hear from Blake Denke, Campus Administrator, the Emeralds.
So just a little background about the Emeralds at Grand Rapids. So we are a 93-bed skilled nursing facility. We also have a 49-bed attached assisted living facility. So we kind of have a different perspective than the previous speakers, as we did have COVID in the facility. But we are very excited to announce that we have been COVID-free for over 5 weeks now. So on June 15th and June 22nd, we did complete point prevalence testing. So we tested all residents, all staff, and the results of those tests were that all residents and staff were negative. So we want to start by thanking everyone in the community that helped us throughout these last couple months. Obviously, COVID-19 is something that people don't really have as much experience with, and it's very difficult to navigate because of the unknown territory. But we want to thank the community members and family members that really helped us through this. We had people that were making us masks. We had random people that sent us pizza or cookies or anything like that, just kind words and flowers even one day for all the staff. We also want to thank those emergency preparedness staff at the EOC, Kelly Chandler and your team, for helping us with supplies. Obviously, when you have many people on precautions, it's using up supplies much faster. But most of all, we want to thank our staff and our residents, because they're the people that were in the trenches and, you know, dealing with everything we had to deal with and making sure that we're staying positive throughout all of this. So even before COVID, starting in March, we had the Minnesota Department of Health here at the facility. We've had them here, I think, 5 times over the last couple months here. And they've been auditing our practices and safety interventions and just making sure that they're providing feedback so we can use the best practices to keep residents and staff safe, which has been really huge for us, even to have a surveyor come in and just, you know, talk about how they were at another facility and this kind of worked there. We also had Center for Disease Control and Prevention here. They wanted to collaborate, look at best practices that we had here, give feedback, and then learn and understand COVID-19 better. We are going to continue the safety interventions to keep residents and staff safe. That means the use of face masks and eye protection throughout the facility, monitoring residents for signs and symptoms of COVID-19 throughout the day, screening staff for signs and symptoms of COVID prior to coming into the facility each day, auditing daily to make sure that safety protocols are met, and just making sure that we're educating throughout the day, throughout the weeks, everything as MDH continues to provide new recommendations. So in order to provide emotional support to our residents, we're coordinating with the Minnesota Department of Health. Obviously, we have a couple things in place already. I know Kyle had talked about it, but we do have the window visits, so family members can come and visit their family member at the window as long as they're 6 foot social distancing, both wearing masks. We next have the scheduled outdoor visits. So this is supervised. It has the 6 foot social distancing as well, and then both people are wearing masks as well. The really nice thing about this is that you can go on our Facebook page and hit the book now button, and that's how you can schedule those visits, and we'll send you a confirmation right away so that you can get in here and see your family member. The other thing is the essential caregiver visits, which both people had talked about already, but we are starting those on July 29th. So we've worked really hard to put together a policy, safety procedures. We've even got an orientation packet that we'll go through with essential caregivers that talks about, you know, what safety interventions they have to use in order to come into the facility, and then competencies for hand washing and proper donning and doffing of PPE. So we just want to make sure we get all those things in place, and then those essential caregivers can come into the facility for 3 hours, provide cares to their loved one and emotional support. So that'll be another huge step towards what we're looking for, getting back to the new normal. So again, we just want to thank everyone for their continued support, and we will continue to provide updates to residents, staff, and family members as new guidelines are released.
Thank you, Blake. We'll now introduce Danny Dunner, Director of Senior Services, Bigfork Valley Communities.
Okay, good morning. A little background on Bigfork Valley. We're a hospital district, so we're connected to the hospital. We have a 40-bed long-term care facility, and then our assisted living is 32-bed. We also have adult day and home care services. When everything started in March, we closed adult day right away. It remains to be closed at this time. We're just waiting for the right time to open it back up. Also, when everything started, like everyone else, we started the virtual visits, hallway bingo, different hallway activities so everyone could be socially distanced, and everyone had to wear their masks if they were out. Currently in our assisted living, we're looking into starting communal dining again. We're just trying to get all the procedures in place so all the disinfecting happens, and we just measured out all the tables today so everyone will be 6 feet apart. In long-term care, we're not going to allow the essential visits at this time. We do the compassionate care visits for end of life. In our assisted living, we are doing the essential care visits and the compassionate care visits, and we just started outdoor visits a couple weeks ago. Families and residents have been very happy. They all have to be scheduled through our life enrichment coordinator, so someone can supervise, like everyone said, and sanitize and disinfect in between. We did point prevalence testing in June. We did it with the National Guard. We had 3 rounds. Everything was negative. And we are able to do the rapid test here on site for any of our staff or residents or tenants, which has been nice. But currently we're only reserving those for any employees in senior services or resident or tenants. And then hospital staff or surgical or hospitalized patients, and any curbside testing if supplies allow. So like everyone else said, I want to echo, the community has been great. We've gotten so many things donated, masks and help from them, and people coming to put hearts up on the windows. And so despite all of the chaos, everyone is finally starting to settle in. We're happy to have the lessening restrictions with the guidances, but we still want to keep safety in mind with everybody. So we're trying to reopen up everything very slowly. That's all I got.
Thank you, Danny. And now we will hear from Monique Fox, Administrator, Essentia Health, Deer River Hospital, and Clinics in Essentia Health, Homestead. You're muted, Monique.
Struggling with the mute button, sorry. But I just wanted to follow, I really appreciate what everyone is sharing as well. And a lot of the information has already been shared for what we're doing here, but really want to echo what Melissa and Kyle were saying is really kudos to the staff and the residents and the families here for being supportive of some of the changes that we had to make as COVID hit our facilities. Couldn't be more pleased with the performance that we're seeing and the results of being able to keep our residents safe. It's very, very important. Here, all the Essentia Health long-term care facilities are working together on actually finalizing the standard policy to implement the MDH guidance for indoor visits. I'm impressed with some of the performance and status of people, where they're at with the implementation of this. We look to have it rolled out by July 25th. The number of visitors will be permitted in the facility at one time will be limited to allow staff to monitor and continue to keep all residents safe. The visits may be stopped at any time if the facility needs to go back into lockdown based on the number of positive cases in the area. One of the things I would just like to echo is it is nice to see that we've been able to try to implement technology to improve visits. And I too really appreciate the opportunity to implement iPads for the video visits, the video calls, the window visits, and the outside visits. It's so important for the psychological and social well-being of our residents, and making sure our family members that want to come and visit know that their family members are still being well cared for. Homestead also understands family anxiety to be able to come in with your loved ones and be there, but we are moving slowly, as others have indicated, and cautiously to continue to keep our high-risk population safe, and the safety of our residents remains our #1 priority. It's really hard as we all struggle and watch the residents and know how much their visits from their family members and outside contact is very, very important. But as we watch the uptick in the numbers, like we say, we're all weary from the distance that we've been going before, but making sure we maintain cautious and vigilance to move forward and open slowly. And it's really nice to hear everyone echo that as well. Trying to balance the two is sometimes difficult. We did undergo our National Guard surveillance, 3 rounds of testing that went very, very well. And so we were pleased with that. And then we continue to screen and limit access to our skilled nursing facility by employed staff. And we also very much highly encourage the outdoor visits in the courtyard, again, to have that so that you can actually have that entertainment and visits with your family members, and make sure that you meet those social guidelines as well. We are very pleased to actually share that we are open to new referrals. We've been working to increase our staffing to allow that in this very difficult time to place patients. So we want to make sure the community knows that we are able to do that now, and we have created that additional capacity. The residents that will be newly placed and received here will undergo a 14-day quarantine, and we have the ability to set that up and support that currently. And we also have open staff positions that we currently have posted for basic care aides, CNAs, and LPNs to continue to provide that great level of service that does require an extra level of staffing to make sure that we can monitor the screening, the surveillance, and everything else that needs to be in place for safe implementation. Again, just sharing and echoing, we do have an independent living facility as well that is managed under different guidelines, and that is our Comstock building. We currently, I'm surprised, but we do have our openings there, but that is very much an independent living and runs under different guidelines. So we are offering screening there, and we do screen all of our residents to maintain awareness of what is going on there, but they do maintain that level of independence and do not have the same level of lockdown as we are currently now in our long-term care facility. Currently have 22 residents in our facility, and we are just working to continue to provide the activity support that we need to keep everyone healthy and safe. And so beyond that, that's kind of where I'm at right now, and I will pass off back to Kelly.
Right, thanks everybody. We are joined by our regional and local media, and if you do have a question, please submit that via chat with your name and the organization you represent. We are at 10:29, but we'll try to take a couple. if there are any questions. I will repeat a couple highlights from the situational update. We are at 113 residents in Itasca testing positive. Our cases have increased by 45 since July 7th, and they're mostly from community spread from both known and unknown cases of COVID-19. Multiple age groups are affected, and we do ask if you are being contacted for a case or contact investigation that you answer the phone. They've been overwhelmingly positive statewide, a lot about education. And then masks have been required starting this Saturday, July 25th in the state of Minnesota in indoor spaces. Frequently asked questions are on our social media, Facebook site for Itasca County Public Health, and we will be providing more information in our next written press briefing. Does anybody have other questions for us or any of the panelists? We have a thank you to everyone on the call from Kathy at KOZY, appreciating all the information we are providing. So thank you, everyone. Okay, with that, we hope everyone stays well and has a great weekend. Thank you.
At Grand Rapids State Bank, we've been a trusted financial advisor to our customers since 1914. We're local, community bankers who understand what it takes to manage a business through thick and thin. Grand Rapids State Bank, your community bank, serving people throughout the Northland.